You have bios for everyone, so we're going to be very brief. Vanessa, we are honored to welcome you, I think, to your first CED event. You write on healthcare for the Wall Street Journal, and we're pleased to have you as the moderator. Lenny Mendonca is a CED trustee who is also the chairman of the McKinsey Global Institute. Lois Quam, I mentioned earlier, our newest CED trustee, who is the managing director of Piper Jaffray. Carl Camden, CEO of Kelly Services, and also a stalwart founding partner of the Better Healthcare Together Coalition, involving Kelly Services, Walmart, the SEIU, CED, and a number of other players. So Carl, thank you once again for being with us. Bo Cutter, a managing director here in New York of Warburg Pincus, longtime CED trustee and a recent co-chair, former co-chair of CED. And I want to stop for 30 seconds on Matt Miller, who is, it says columnist, Fortune magazine. He's much more than that. And I told him I was going to do this. He has a new book coming out. And he didn't ask me to do this. In January of 2009, all CED trustees will get a copy of it. We're actually going to order 210 copies from the publisher. The book is called The Tyranny of Dead Ideas, Letting Go of the Old Ways of Thinking to Unleash a New Prosperity. It will be an immediate bestseller, in part because of our purchase, but it's a great, it's a great book. He says wonderful things about CED in it. We didn't know he was going to do that, but you have to read this book. So thank you very much, all of you, for coming. And Vanessa?
And I just want to thank the CED for inviting me as well, because this is a topic that's of high interest to me. I think in the years that I've covered healthcare, in all of this debate about healthcare, I think employers and the business community are probably the most enigmatic and perhaps tortured player and also key player in all of this. You know, on one hand, employers are desperate for help with their healthcare coverage costs and change, and yet they're very reluctant to let go of the employer healthcare system that we have today. Many of them, or most of them I should say, really want to make sure that we cover everybody, but most are pretty skeptical about the idea of mandates. And so it's going to be pretty fascinating to see what kind of proposals they galvanize around in the next year. So without further ado, let me present our panelists who will present their own views on the current what the business community thinks about the healthcare system and its potential alternatives. And we will start with Mr. Cutter.